Hello, I'm Jane Williams. Welcome to Webinar 10. We'll discuss clinical indicators. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. Objectives will cover clinical indicators, practice information sheet, consideration of patients' rights, beliefs, religious and cultural background, practice governance, Accreditation Day. Clinical indicators. The practice uses patient data to support quality improvement activities. Patient health summaries must be up to date to reduce the risk of inappropriate management, including medicine interactions and adverse side effects. Having up-to-date information on medicines means you achieve best practice prescribing. Access of patient information to other health practitioners. As part of the government's plan to enable patient health information to be available online and to be accessed by other treating practitioners in an emergency situation, patient health summaries are able to be uploaded to a secure portal. GPs upload these summaries with patient consent at the time of consulting. Copy of healthcare summary to patients. Health summaries, which as it indicates is a summary of the patient health record, are also attached to referrals to specialists and to allied health. It is useful for patients to have a copy of their own health summary. On-site medications. There are a number of medications which practices keep on site for the sake of convenience. Immunisations for childhood illnesses, flu vaccines, hepatitis vaccines, and tetanus, to name a few. These medications must be checked monthly for expiry dates and disposed of in the appropriate fashion if expired. Practices often keep patients' injections in the vaccine fridge. These are to be treated as any other vaccine and recorded and disposed of in the correct manner. Practice information sheet. Your practice information sheet must be available to patients in the waiting room. It must contain the names of the GPs and perhaps their specialties, staff and nurses' first names only, days and times of consulting and how after-hours care can be accessed, explanations on how messages to GPs are handled and how test results are obtained. Costs of consultation and billing methods should also be included. Explain the practice's policy on managing patient health information and how patients can provide feedback or make a complaint. If the practice has a website or an in-house televiewer, this information must be on all. Consideration of patients' rights, beliefs, religious and cultural background. In providing patient health care, does the practice consider the patient's rights, beliefs and their religious and cultural background? The survey team asked this question. Reflect on how you will answer. If there is a particular ethnic group attending the practice, consider having practice information printed in that language. On the new patient form, ensure that you ask people to identify as Aboriginal or Torres Strait Islanders or any other cultural group. Gender identification. Also ask to identify male, female or other. Ensure to address patients can be provided privacy. If you do not have a spare room, perhaps ask the patient to remain in their car. If you have a back entrance, then maybe the patients can enter this way. Patients with disabilities. Make sure patients with disabilities can access patient services. You may need to install a ramp. Ethical dilemmas. Discuss as a practice what constitutes an ethical dilemma. This question is asked by the GP surveyor when he interviews the GP. Third-party consultation. If a third party is to be present in the consulting room, ensure you get permission from the patient for this to occur. This will include medical students, registrars and case conference participators. Scan this consent into the patient notes. Transfer of patient information. The practice only transfers patient information to a third party once the patient's consent has been obtained. Be clear on the way the practice transfers patient health information to another medical service. If done by mail, please register the package and scan the registration into the patient notes or store in a postal record book. Practice governance. The Australian Commission on Safety and Quality Healthcare notes that good governance is participatory, accountable, responsible, equitable and inclusive, consensus-orientated, transparent, effective and efficient, compliant with all relevant laws. Good management and leadership foster a culture that is based on mutual respect. When you have this, the entire team will be supported to achieve excellence in all areas of the practice and participate in just and open discussions on how the practice can improve. All research conducted by the practice must have the approval of the Ethics Committee and indemnified. This approval must be cited at accreditation. Safety, health and well-being of practice staff. Discuss how you feel the practice supports the safety, health and well-being of the staff. This is a question at accreditation. How does the practice do this? Work health and safety policies. Having these policies in place and explaining them clearly. Having a policy and procedure manual available for all staff to access. Offering immunisation, by offering immunisation relevant to roles within the practice. Regular staff meetings, by having regular staff meetings and by having procedures in place to allow staff sickness to be covered. No blame policy, having a no blame policy in place. Some other things not to be missed. Patients' own role in treatment. Patients must be informed of the purpose, importance, benefits and risks of the medicines and treatments, and they must be aware of their own role in treatment. Checking of medical samples. The person in charge of checking the expiry dates and rotation of any medical samples kept at the practice must ensure they are administered, supplied and disposed of in accordance with manufacturer's instructions. Issuing patients with a sample drug. Always ensure that if a GP introduces a patient with a sample drug, the patient's name and address are placed on the label, which is placed on the sample, together with the instructions for administering it and the name and address of the GP providing it. Finally, Accreditation Day. Please ensure that on the day of the visit there is a room available for the surveyors. The GP surveyor will need access to a computer to access the patient notes. If your practice information is in Practice Hub or the cloud, the co-surveyor will also need computer access. The GP surveyor with AgPal will need 50 minutes to an hour with the GP who is designated to be interviewed. They will also need time with the nurse to go through the equipment, the vaccine fridge and the doctor's bag. They will also require documentation of maintenance of key clinical equipment. Regarding patient notes, generally a selection of files from each of the practitioners on staff are selected. The surveyor looks at referrals, documents received, consultation notes, and the medicines prescribed. There must be evidence of home visits, telephone calls, and after-hours consultations. It is often worth the practice selecting various GP notes and assessing them prior to the visit. Content of referrals is important, as is an up-to-date medication list. Remember that the practice referrals are a window of showcasing the practice. If referral letters are brief and contain little or no information, the specialist receiving that referral may wrongly assume lack of patient care. The co-surveyor will interview the practice manager, practice nurse and reception staff. They will then go through a checklist of policies and procedures to ensure everything is correct and up to date. Thank you for taking the time to join this webinar today. Country SA PHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysaphn.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.